Infectious disease specialist Dr. Zain Chagla joins us again this week for an update on things. So many things going on again. And two new variants revealed this week.
Yeah, so we see the C12 variant, which is actually the C1 strain that had a couple more mutations and a complex of them that's circulating. It was first discovered in southern Africa. It's been described really since May, but some reports suggesting now about 2% of isolates from that region are this. Now, it's still not clear whether or not that one is circulating much more in the world. Similarly, the Mu variant, which was seen in Colombia, again, is being seen a little bit more in the world. It has some mutations that could lead to a little bit more immune escape, but still not clear again whether or not it becomes a dominant strain or again is something that was just overrepresented as part of an outbreak. The point here is, though, these two have emerged in countries with very low vaccine rates, with highly susceptible populations, and led to variation that's then led to spread. And again, that common theme of us needing to vaccinate the world to really stop variant spread is becoming more and more important by the day.
Because we're worried here about boosters and getting young children vaccinated, where there are so many countries where first and second doses just are unheard of right now.
Yeah, absolutely. And when you have a population of tens to hundreds of millions of people living in poverty, living in poor situations where the virus can spread person to person, in sub-Saharan Africa, a major concern is the fact that up to 15 to 20% live with HIV there. You all of a sudden have the right kind of characteristics for a variant to emerge. Really susceptible populations, immunocompromised populations where the virus doesn't clear as fast. And so, yeah, even from a selfish standpoint, not only just to save people, but from the standpoint of keeping this virus at bay from mutating, our duty is to actually vaccinate the world for us to all get back to normal.
Right. Now, why do viruses mutate, and why do they mutate in different forms in different areas?
Yeah, so when viruses replicate, when the DNA replicates or the RNA in a virus replicates, it does make errors, and in fact are more error prone than things like human beings, which are actually really controlled in how they replicate. And when you have, a virus replicating millions and millions of times, you get a few errors. Now, some of them, the virus may die, it's not compatible with anything else, but rarely you get one replication event that then leads to an error that leads it to be more fit, and with natural selection, starts representing itself more and more and more.
And becomes more powerful, right?
It becomes more potent, it infects more people, it may escape immunity. And these tend to happen, we think, in people that have compromised immune systems who are infected for weeks to months, not just the typical 10 days the average person is, which is why places like sub-Saharan Africa are very, very concerning, because they have a lot of immunocompromised people and a lot that aren't being tested or treated for COVID-19 appropriately.
Right. I actually heard something from one of the doctors on the science table yesterday who said if we were just dealing with the alpha variant of COVID-19, it would have been gone by now, right? But now we have all these other ones.
Yeah, absolutely, right. The characteristic of the alpha variant was that it led to, 4 people being infected for every infection, which meant if you vaccinated a certain number of people, 80% of the population, you would get a significant reduction in transmission. Whereas this variant, now Delta is 6 to 8 people for every single case. It means that even with the high levels of vaccine, it keeps finding its way into unvaccinated populations.
Right.
One of those 6 people is likely unvaccinated. We have kids that are unvaccinated. And again, it keeps going and going. It still has fire to keep growing.
Right. And even people who are vaccinated can still get, right, and still carry. So that's why we've got to be wearing masks again and social distancing and be very, very careful. Like, getting fully vaccinated is not a free-for-all.
No, absolutely. I mean, again, if we have high levels of society, and really now we have to count on kids getting vaccinated at some point, not only for their own protection, but also from the population standpoint. Until that happens, it's going to be very tricky to control this virus with just vaccinations alone. The good news is, though, everyone who gets vaccinated has a significantly reduced risk of getting sick with this virus, of landing in the hospital, of going to the ICU. And so even in the context of us not having complete control with just vaccines, an individual still has a whole better of an outcome if they get vaccinated as compared to not.
Okay. Always fascinating to chat viruses with you. Thank you for joining us. Have a great weekend.
No problem.